Welcome back to Environmental Science 446-546. The course is Drinking Water and Human Health. Today we're going to cover Lecture 18. We're going to continue with our discussion on microbial contaminants. We've spent 3 lectures talking about the bacterial contaminants that can adversely impact human health. Today we're going to continue with microbial contaminants, but talk about a different class of microbes. The focus of this lecture will be on the microbe Cryptosporidium. If we take a look at our overall outline, in the past 3 lectures, we've talked about drinking water and infectious diseases. We've talked about bacterial infections. And today, we're going to center our discussion on parasites. First of all, what are parasites? Or at least, what are the parasites that we would like to discuss? The type of parasites that I'd like to talk about today are classified as protozoa. These are one-celled parasites that are members of the kingdom Protista. They're different from bacteria. Even though they're one-celled organisms, they tend to be larger than bacteria. They're still microscopic, but they're different from bacteria in that they act like tiny animals. Protozoa are ubiquitous, which means we find them every place in nature and in particular in water. We're spending time talking about protozoa because they are a problem in drinking water. If you ingest some drinking water that has live protozoa in it, it might lead to intestinal problems. Science has showed us that we don't need a lot of protozoa in our drinking water glass to cause diarrhea. As a matter of fact, the infection level, we don't need as many protozoa in water compared to bacteria to cause diarrhea. So fewer individuals are required to cause problems. The next issue with protozoa are that you just can't add chlorine to the water and kill them. Protozoa are much more resistant than bacteria to disinfectants. They're harder to kill, so they're more likely to slip through and actually cause problems for humans. Protozoa are a problem. The total number of protozoan waterborne infections outnumber the number of bacterial infections in the United States. So it's a much bigger problem than the bacterial pathogens. Remember, we have the technology to easily take care of the bacterial problems. We have the technology to take care of the protozoa problems, but that technology is very expensive. Consequently, we tend to have more problems with protozoa. Also, compared to bacteria, our knowledge about these protozoa are more limited. We don't know as much about their biology, and we don't know as much about their behavior. If we knew more about the protozoa, we would probably have better techniques to get them out of our water. Protozoa continue to be a problem in drinking water, and in fact, year by year in the last 20 years, many new problems have surfaced about protozoa, things that we didn't know were problems in the past. So this is becoming an increasingly big problem in drinking water health. Because of that, I say the protozoa may be the most difficult category of microbes to deal with in drinking water. May is a pretty easy word. They probably are the most difficult category of microbes to deal with when we talk about protecting drinking water. There's one particular genus and species of protozoa that are a big-time problem. This genus and species is Cryptosporidium parvum. Cryptosporidium parvum lives in the intestines of animals. It's common in the intestines of animals. Humans get Cryptosporidium by ingesting water that is contaminated with animal feces. That's one way we can get Cryptosporidium. We can get Cryptosporidium by touching animals or infected people that are not properly washing hands. So by touching animals or by touching infected people and then not washing our hands after we touch the animal or the people, we may actually ingest those Cryptosporidium organisms if we happen to touch our mouth. Now let's talk about the disease that's caused by Cryptosporidium. We actually have a name for it. It's kind of hard to pronounce. Cryptosporidiosis. Not a very original name. We just took Cryptosporidium and turned it into a disease. It's called cryptosporidiosis when it reaches the human intestines. Again, cryptosporidiosis when it reaches the human intestines. Characteristics of this disease include all the things we don't like. Not particularly toxic to us, but it will make us feel bad. Watery diarrhea. Very characteristic. That's often accompanied by substantial weight loss, where people have such bad diarrhea they just can't keep things in their system, and over a week or two, they tend to lose quite a bit of weight. General body aches are characteristic. Vomiting. Gas. And accompanying the gas, probably some bloating. And then fever. Usually a low-grade fever, 100 degrees, 101. Not a very high fever. But Cryptosporidium really makes a person feel really awful. Watery diarrhea, your body's aching, you're vomiting, you may have gas or bloating, and you will have a low-level fever. This type of disease caused by microbes was first described in 1907. The specific organism that causes this type of sickness has been recognized as a pathogen since 1976. So Cryptosporidium has been recognized as a pathogen since 1976. Now, if we ingest the pathogen through drinking water, it takes a few days for the symptoms to show. There's an ingestion time, or what we call an incubation time. If a person ingests drinking water that has significant numbers of Cryptosporidia in it, it may take 2 to 12 days for the symptoms, such as watery diarrhea, to show in the victim. An average incubation time is about 7 days. Now, if you're a healthy adult, you can weather Cryptosporidium pretty well. In a healthy adult, you ingest drinking water that has Cryptosporidium in it. After a few days, maybe 7 days, you develop the symptoms: watery diarrhea, bloating, gas, low-grade fever, vomiting, and you'll have that sickness from anywhere from 4 to 14 days. So it could be minor, where it will make you feel bad for 4 days, or it could keep you down for 2 weeks. So that's serious time. But if you're a healthy adult, you're apt to rapidly recover. Now, these organisms haven't died within your system. Research has shown that you may continue to shed Cryptosporidium organisms in your stool for many months, but you've gotten used to it, that particular infestation, and it doesn't bother you anymore. So if you're a healthy adult, you don't have that many problems. You're going to get sick, you're going to feel awful, probably wish you were dead during that 4 to 14 day period. The problem comes in with other types of individuals. Children are much more susceptible to cryptosporidiosis than adults. So children are more susceptible to cryptosporidiosis. And basically what happens is Cryptosporidium comes in, they cause diarrhea, they cause a sickness in a person, and the disease runs its course, anywhere from 4 to 14 days, and then it's always self-limiting, and a person will have a complete recovery. With one exception. We found that people that have impaired immune systems sometimes have a really hard time getting over cryptosporidiosis. And people with really poor immune systems may never recover from this disease. They may have this disease the rest of their life. They may have a watery stool for the rest of their life, never have a hard bowel movement again. So if you do not have a decent immune system, if it's very compromised, if you get cryptosporidiosis, this could almost be life-threatening. You may develop chronic diarrhea. And this is one of the reasons why CDC and other people involved in public health really worry about Cryptosporidium. There's a type of people that have poor immune systems that have a history of having real problems with this disease. The relationship between AIDS and cryptosporidiosis is a very good relationship. You've got people that have weakened immune systems if you have AIDS, and these people have a very high risk of developing chronic cryptosporidiosis. And we've seen many cases where people that have AIDS and they develop cryptosporidiosis basically have lifelong diarrhea. And the problem with lifelong diarrhea, first of all, it's uncomfortable, but the real problem is dehydration. You always have to deal with the chance of getting severely dehydrated. And these people with the poor immune systems and getting chronic cryptosporidiosis, you end up with a very, very poor quality of life. Now, oftentimes in the past when people have died of AIDS, they're very susceptible to many different diseases. Their immune system is so weakened. But usually when they die, they usually attribute death to one particular defining illness. Research has shown that in the last 25 years, that about 2% of the people with AIDS have cryptosporidiosis as their AIDS-defining illness, that's their biggest problem. And over the last 30 years, 18% of hospitalized AIDS patients have been found to have cryptosporidiosis. Almost 1 out of 5 people that have AIDS that have been hospitalized have this disease. We also see similar problems, cryptosporidiosis with cancer patients. People that are taking chemo or radiation therapy basically have their immune systems almost knocked out, and they are very, very susceptible, and they end up with the same type of problem. They're very susceptible to cryptosporidiosis. Well, how many protozoa of the name Cryptosporidium parvum does it take to get you sick? What kind of dose is problem? There's a lot of evidence out there. A lot of people have been studying Cryptosporidium for the last 30 years, so we know quite a bit about the disease and its cycle. There's evidence that low levels of Cryptosporidium occur in most surface water supplies in the United States. So if your community gets their drinking water from a surface body of water, such as a river or a lake, there's probably a low level of Cryptosporidium in the water. As a matter of fact, there are a lot of communities in this country that have easy access to surface water. In the state of Idaho, Coeur d'Alene does. If we take a look at Boise, they have easy access to the Boise River. However, the public health officials in Coeur d'Alene and Boise would rather use groundwater for several reasons, but one of the determining factors is that they don't have to worry about Cryptosporidium coming from groundwater. If we look at some evidence, one of the good studies that's been done in the last few years, that Cryptosporidium is present in almost 97% of the surface waters in this country at very low concentrations. And when we say present, it may be you may have a few hundred organisms in a lake that covers 400 or 500 square miles. But Cryptosporidium happens to be everywhere. Now, why is this? Think of a lake. Let's think of Lake Coeur d'Alene. Lake Coeur d'Alene is a beautiful, clear lake. Is there Cryptosporidium in the lake? Probably. How does it get there? Well, look at the land surrounding Lake Coeur d'Alene. Look at all the wild animals. Look at the deer. Look at the elk. Look at the coyotes. All of these animals just naturally have Cryptosporidium in their intestinal tract. The Cryptosporidium does not harm these animals. It's just part of their bacterial or microbial flora. When they defecate in the watershed and it rains, that Cryptosporidium can roll off the land into the lake. So Cryptosporidium tends to be in all surface waters, although at very low concentrations. The Center for Disease Control estimates the dose to cause the disease in a person is somewhere between 10 and 500 cysts. So if you got as few as 10 cysts of Cryptosporidium in your glass of water, you could actually get the disease. We've even seen cysts survive treated drinking water. You could treat drinking water very aggressively, and you can still have a low concentration of cysts per liter of water. So it's kind of luck of the draw if you're going to get a cyst in your drinking water. Where outbreaks have been studied, they've looked at a number of cyst levels, or the cyst levels in the water, in watersheds where we've seen outbreaks. And we've seen outbreaks of Cryptosporidium in the public where the number of cysts, or what I would say dormant Cryptosporidium organisms, are measured at values of only 0.16 to 2.2 cysts per liter of water. Very, very, very low levels. So you aggressively treat the water and you don't kill all the cysts. The difference between a bacteria and a protozoa, such as Cryptosporidium, is that Cryptosporidium or bacteria have a resting stage. And during that resting stage, they have a thick shell, a thick cover. And it's very difficult for chemicals to penetrate that cover and actually kill them. So if we go back to Cryptosporidium, some of its problems, these characteristics make it a great organism for survival in the environment, but it's a really tough organism for humans to deal with. Cryptosporidium is pretty persistent in the environment. It's pretty persistent in water. It's tenacious, which means it can handle a lot of treatment. It's tenacious because if you look at the life cycle of Cryptosporidium, there's a resting phase where a cyst is formed, and that cyst has a thick wall, and that protects it from chemicals that might kill it. We actually call this cyst phase an oocyst. And an oocyst is basically where you have a very hard shell that surrounds that protozoa, and that hard shell is impervious to some of the things that we would throw at it, like antibiotics. It's often impervious to something like chlorine. We add chlorine to the water, it kills the bacteria, but not the Cryptosporidium. We have a history of many documented outbreaks of Cryptosporidium in the United States, in Western Europe, and throughout the world. So let's take a look at some of those documented outbreaks for a few moments. Remember, it was back in 1976 that Cryptosporidium was actually identified as the pathogen. So the research on that or the ability to recognize that in future studies started in the early 1980s. So if we go with some of the first documented cases, we go to 1984. In 1984, there were 7 well-documented cases of Cryptosporidium in drinking water from 1984 to about 1990. 7 documented cases in that period of time. Places like in 1987 in Georgia, in one incident, we had a lot of Cryptosporidium in the water. 17,000 people got sick. CDC came in and found that there were 2.2 oocysts per liter of water. Very, very low contamination levels. You really wouldn't expect an outbreak, but 17,000 people getting sick at the same time tells you that that's a problem. But the mother of all outbreaks, when we talk about microbes or inorganic chemicals or organic chemicals or radionuclides in the United States, was Cryptosporidium, and it occurred in Milwaukee in 1993. In 1993, within a 2-week period, 400,000 residents of Milwaukee got sick, and it was quickly tracked to Cryptosporidium. Now, remember, healthy adults can weather Cryptosporidium pretty well, but you're going to be sick for 4 to 14 days. You're not going to feel good. So 400,000 people got sick. They attribute probably 125 deaths to this outbreak. The scariest thing about this outbreak was that when the CDC went back and they looked at the water that people in Milwaukee were drinking, the oocyst count was only 0.16 oocysts per liter of water. That's background in most surface waters of the country that are served to drinking water consumers. Very, very low levels. The one thing that is common, if we go back to 84 and look at the outbreaks between 1984 and 1993, including Milwaukee, all 7 outbreaks had used surface water. And all 7 outbreaks had public water systems that treated surface water properly, and the water was disinfected with chlorine. Yet, the Cryptosporidium survived. So 1993 was the big time that we had a huge outbreak. Since 1993, there have been 27 incidents of Cryptosporidium outbreaks in the United States. None nearly as big as the Milwaukee incident. Lots of times these incidents were 500 to 700 people. But from a public health standpoint, Cryptosporidium remains as one of the biggest problems that we need to consider when we talk about drinking water quality. Now, where do we get some documented outbreaks? All of it's from water. The early outbreaks were all from water supplies that were documented as properly treating water. We can also get Cryptosporidium from swimming pools. Remember, we chlorinate swimming pools, but you've got to remember that they're a problem because Cryptosporidium can survive in the oocyst phase chlorine. We've seen many documented cases of Cryptosporidium spread through water amusement parks. And I can't say enough that recreational swimming is a risky activity when you're worried about something like Cryptosporidium. Recreational swimming in lakes and things like that. The EPA does monitor Cryptosporidium in water, but the problem is it's very difficult to take out of water. Well, a healthy adult can get Cryptosporidium. They can tolerate it very well. They're sick for a few days and they fully recover. The biggest issue is how do we treat water so that it is Cryptosporidium free for people that are in high-risk categories. We have ways to take Cryptosporidium out of water, but it's not cheap. For instance, we can filter the water. We can use semi-permeable membranes that have openings smaller than the diameter of Cryptosporidium and thus eliminate the Cryptosporidium from the drinking water. That's preferred, but it's very, very expensive, particularly in a city where you're producing millions and millions and millions of gallons of water for people every day. There has been some trials where treating the water with ozone may help reduce Cryptosporidium populations. Reverse osmosis, which is basically the same thing as filtration, will work, but it's very expensive. We could distill the water. That would work. Boil the water, get the steam, recondense the steam, but the water cost is so outrageous from a process like that that a public water system couldn't afford to do it. And simply at home, people could boil their water. It's easiest because the public water system doesn't have to do it, and it's cheapest probably because the individual homeowner would bear the cost and they'd only boil the water that they plan to drink or cook with. Or the other alternative is to go to bottled water. If you think you have Cryptosporidium in your water source, you need to make sure that it's distilled or deionized water, because distillation or an osmosis or filtration would remove that Cryptosporidium. Because you could have bottled water, and if it's not distilled or deionized or filtered, it may still have some Cryptosporidium in it. So what we learned today is Cryptosporidium is a problem. Cryptosporidium is the major reason why many communities and public water systems in this country, if they have a choice between groundwater and surface water for their consumers, go to groundwater, because you just normally do not find Cryptosporidium in water contained in aquifers. Okay, when we come back to our next lecture, we'll continue to talk about microbial contaminants and including things like viruses and algae. Thank you for your attention.